We are here today to announce a significant step in the federal government's ongoing work to keep our nation's healthcare system free from fraud and exploitation, and to ensure that taxpayer dollars are used lawfully and appropriately. Now, over the last 3 days, the Medicare Fraud Strike Force, a joint effort between the Department of Justice and the Department of Health and Human Services, executed a significant nationwide healthcare fraud takedown. Now, this action involved charging or unveiling charges against approximately 300 defendants in 36 federal districts for their alleged participation in a variety of schemes involving more than $900 million in fraudulent billings. This makes this the largest takedown in the strike force's 9-year history. Now, the defendants who were named in these charges include doctors, nurses, pharmacists, physical therapists, home health care providers. They're accused of a wide range of serious crimes, from conspiring to commit healthcare fraud to making false statements, and from bribery to money laundering. They submitted dishonest claims, they charged excessive fees, and they prescribed unnecessary drugs. Now, in addition to the usual patterns of fraud and deception that we've encountered in the past, we also saw new trends emerging in this year's charges. Now, for instance, in a number of cases involving the Medicare prescription drug program known as Part D, we saw new evidence of identity theft, including the use of stolen doctors' IDs to prepare fake prescriptions. Now, we've also seen a growing number of cases involving compounded medications. Now, these are the combinations of 2 or more drugs that are prepared by a licensed professional. And in recent years, the cost of these types of drugs, compounded medications, has grown exponentially, which makes them all the more attractive a target for criminals looking to exploit them for profit. Now, as this takedown should make clear, healthcare fraud is not an abstract violation. It's not a benign offense. It is a serious crime. And the wrongdoers that we pursue in these operations seek to use public funds for private enrichment. They target real people, many of them in need of significant medical care. They promise effective cures and therapies, but they provide none. And above all, they abuse the basic bonds of trust between doctor and patient, between pharmacist and doctor, and between taxpayer and government, and they pervert them to their own ends. And the Department of Justice is determined to continue working to ensure that the American people know that their health care system works for them and for them alone.